So, being born in a lower middle class family in North India, I had really an unremarkable childhood. I remember endless school days punctuated by summer vacations, which I hated. In school, while reading Keats and Shelley, I always wondered what's so poetic about a warm summer day? Yes, we had mangoes, but without electricity and fans for major part of the day, summer isn't a particularly enjoyable experience for billions in the developing world. It's infernally hot. A scorching wind, it blows all day, and the sun, a giant flaming blowtorch, it throws fire. With continued visions of the fourth and the sixth circles of hell, we pray to Lord Almighty to deliver us from the heat now and for the hereafter. And really, that's literally all we can do, during that summer. Because, without a fan during the many power cuts, I remember the smell of kerosene, of being drenched in sweat, endlessly sitting and studying in front of a lantern, a candle, or a gas lantern on the nights before exam because gas is expensive. So too close to the candle and my front ear would kind of singe. And for some relief, we had hand fans. And but they cannot be used while studying close to the candle because they will blow off the flame. So we would carry buckets and spray the lukewarm water on the walls and floor to cool the house a bit. And taking turns, we still used the hand fans while we could, and we moved them till we were really tired and our hands hurt and exhausted. We would basically fall asleep, but then wake up sweating and drenched in sweat, and then move the fan again before eventually collapsing again in exhaustion. And so this cycle repeats all night, every night, during power cuts, obviously. And when we were fortunate, and in a sense, we were fortunate to actually have a power connection at home. I mean, that's not the case for a lot of people there in India. I mean, almost like 300 million people there actually do not have a power connection at home. And for context, I mean, that's the entire population of the US. So anyway, my father he would travel a lot when we were young, and with him I would travel to, places in India, villages, places I saw abject poverty, really, really poor people. And for somebody who was either poor or just a level above that poverty, the only way to rise up was to study really, really hard and, have a career, as was mentioned previously, to, become a doctor or engineer or a civil servant. Then that was the only way. And so that's what I did. I studied really, really hard, and I ended up in med school. So I became a doctor, and hopefully I would have a better future. In medical school, everybody wants to be a cardiac surgeon or a neurosurgeon. And so I didn't really know why, but I still wanted to do the same because everybody was doing it. In the third year of medical school, I was sitting in this community medicine class. It was taught by a really interesting professor. His name was Dr. Ali Amir, and he was talking about this power of prevention. He was a colorful personality. He was a student leader, a writer, and an excellent public speaker. And he was explaining how really simple interventions could be really effective in saving lives. He talked about ORS, a pinch of salt, sugar, a spoon of water, of sugar, and a glass of water had saved almost 50 million lives. And that struck me, 50 million. I mean, there was no way any clinician would ever be able to come close to that number. So it's true, if you work in public health, no one would really come and say those cherished words, "Doctor, you saved my life." Yes, it's a thankless job. People only remember when prevention fails, but it saves millions of lives. And I came to understand the power of prevention, that health interventions don't have to be expensive or glamorous to be effective. So I took up public health as my calling. I was told I was throwing away my career. Doctors were supposed to be in scrubs, doing surgeries, not work in villages. I spent the next 3 years there, spending greater part of my time looking after sick in villages, in slums, in mobile health clinics during my residency, and I did my dissertation along with the same professor. And things were going well. I got a scholarship to study a public health program in Europe, but somewhere deep down there was still a hesitancy whether I was doing these things which I was doing okay. So I thought I'll maybe ask my supervisor again. So gathering courage, I asked him the question. It was still bothering me. I was brought up to escape my own social class, to aspire a certain kind of life, a safe life, a life full of stability and structure. So I asked him whether is it okay to not live a structured life. He was really sick at that time, and he asked me, how much structure do you really need in your life? The university where we studied, it had everything. It had its own security, its own gas station, it had its own graveyard. So he told me, I can tell you precisely where I will be buried. How much structure do you really want? So that was shocking. That was true. what was there to be so much afraid of? So for my first job, I moved to a city called Ahmedabad in India. And it's a city divided by social groups. The work was good, and my colleagues were really, really wonderful. When I arrived in Ahmedabad after a really hot summer, and there was this terrible heat wave that had happened that year, 2010, which had killed many people. So I decided to study how and why heat kills people, like remembering my own childhood, and what can be done to protect poor people from such intolerable heat. So newspapers had reported few deaths. We counted thousands of death certificates, and those were probably underestimates because if you're a migrant, homeless, poor, you probably don't have a death certificate issued for yourself. I surveyed slum communities, interviewed construction workers. Workers themselves were migrant and from other parts of the country. Their living conditions were beyond description. Women workers would carry their kids to work, and they were forced to leave them there on the searing heat on the work sites. The workday there is non-stop. There are no restrooms or fans at the work sites. In the heat, the workers they avoid wearing safety shoes, hats. They often hurt themselves, get into accidents. But as bad as the days are, the nights are even worse. Because with global warming, what we're seeing is that there is actually a bigger increase in minimum temperatures at night than the maximum temperatures in the day. So there's just no relief in those nights. I mean, workers, being migrants, they sleep in makeshift shacks, which are covered with tin roofs, without fans, and the roofs still burning from the hot day. So our studies of this heat wave deaths in Ahmedabad taught us several things. Not only that who was dying and why, but what can be done to prevent heat wave deaths. And trust me, those numbers are huge. We're talking about tens of thousands of people dying everywhere, including in Europe and Russia and all these countries. We've recorded heat wave deaths. And the measures are really simple. It's not just knowing that the heat wave poses a danger to health. That itself is protective. Simple measures like staying hydrated, temperature forecasting, hospital, health services preparedness, these all save lives. So based on our work, the government of India is putting in place heat preparedness measures in several cities. And hopefully next time when a heat wave strikes, hopefully some lives would be spared. And so in that sense, I mean, this is the power of public health. To this day, I've never heard an individual actually patient come and tell me, doctor, you saved my life. But I know the work that my colleagues and I do, in fact, does save lives. If thousands, if not millions, definitely. And that's all the confirmation I need that I'm on the right path, structure or no structure. So, thank you. Thank you so much.